Unfortunately, we are number 3, according to the IDF, which is International Diabetes Foundation. And it was announced in December 2011 in Dubai, when we were there in their meeting, global meeting. And that has been, it is sad to hear this, but I'm very sad to mentioning it, because it will have the effect of it we have not seen yet, because it's a younger generation as well as the old. But you will have a lot of problems in the future if we don't do anything today now to people to understand what to do and what not to do. It would have been a disaster for, as far as I'm concerned, disaster and a model of disaster for the world, but disaster in the country. And the cost would be unbelievable to the government and to the people. And the life expectancy and the living conditions and going to the hospital. At the age that you have to produce and help, you will be a disease, you will be the patients who will not be able to do that for your country. And that's the problem, I guess. But simply it happens in the last 21 years. After the liberation of Kuwait, the whole lifestyle changed. The children are always out. They are in, basically the food is become very much available in the country outside the house. There's a lot of places that they give you wonderful food, large size, and the calories are not mentioned, and education is not there. And we just changed our lifestyle. And that was, and it's not only for Kuwait. As a change of lifestyle, and this is throughout the world, even in Africa, which they only had, they did not have chronic diseases, basically. And they have other diseases, which like malaria and so on. It's now you have diabetes. So with a little money, more, the first thing is that sugar is nice. And if you look at the amount of the calories in any drink you get, it's quite a lot. And if you don't exercise, and all of us are having luxury of having car and private cars and moving around, we don't walk, we don't exercise, we don't do things what we used to do when we were a kid. When you come after the school and coming back, we are playing in the garden, in the street and playing football. It doesn't exist anymore. Or does not exist as much as it used to be in there. And don't forget, 40% of the Kuwaiti population is less than 15 years of age. And 60% is less than 20. So that is the population is going to be affected. More than my population, my age group, which will be affected. And that's the problem. The problem is you have over 250,000 Kuwaitis with diabetes. I don't have that facility. So that's why we are looking at how to help the health system in Kuwait to have the standards which is here will apply to those for the people. And what we do more and more on research to understand the issues scientifically, and also to understand how to use the facilities here. People use it for education, even if you're not sick. That's important. We have about 100 e-learning courses we are developing. We already developed more than 60. And we're going to go in schools. And we have, we'll have a nice magazine for children, which is monthly magazine, which is coming out, to take them through cartoon characters in order to understand what they should do and what they should not do.